Okay, good afternoon, everyone. Thanks again for joining. My name is Lauren Jones. I am one of the senior account managers and data strategy lead for organizational membership with MGMA. First of all, I'd just like to start up again by thanking you all to take the time today and join us for this open house over DataDive and the new refresh we recently launched. Organizational membership has grown significantly over the last 5 years now, so totaling about 50,000 members across 800 healthcare organizations. Our DataDive product is one of our premier offerings to our customers and members, helping the medical practice community operate a medical practice at an optimal level through the utilization of benchmarking data, which some of you may be familiar with. We've definitely listened to our members and customers' feedback over the last few years with a goal of enhancing the DataDive experience and ease of use. So what you're about to see is a completely refreshed version of DataDive designed to provide ease of navigation, better flow through the survey sets, etc. I would like to start by introducing the team that we have on the call today. So first we have Mary Tower Mina. She is one of our coordinators on our team for our membership group. And then I also have with me Liz Gurley, who is our data strategist on the team. And then we're also joined by Michelle Mattingly, who is the director of our data solutions team. So with that, I'm going to turn it over to Liz, and she will be giving you the demonstration for today. I am going to drop down in the chat here her contact information. Definitely, as she demos this, if you find that you are interested in doing any follow-up one-on-ones with her, don't hesitate to reach out through that email that I'm going to drop down here, and feel free to use the chat feature too for any questions you have along the way. We have a team here who are happy to help answer any questions you may have. All right, go ahead, Liz.
Thank you so much, Lauren. I appreciate the introduction. As Lauren mentioned, my name is Liz Gurley. I'm a healthcare data strategist here at MGMA. Bear with me just a moment. I'm going to share my screen. Perfect. So my role is really supporting organizational members from a standpoint of a resource. So I work with organizational members in terms of custom reporting, demonstrations, trainings, one-on-ones, pulling data, again, and creating those custom reports. So I'm going to go along with you today in looking at our new DataDive product in terms of us just updating the system. We have launched a new platform that was launched in May. So some of you may already be aware of the new platform that's taken place, but definitely wanted to spend some time today providing you an overall navigation of the system. All right, what you should be seeing on your screen now is a slideshow here of this lovely astronaut gentleman, as I'm referring to him. It's just talking about the new DataDive platform. This is the UX, so the user experience. As Lauren mentioned, we really wanted to take the feedback of our users, our data purchasers, organizational members, those of you that are in DataDive like us every single day wanting to pull out data, and make it a more intuitive experience for you. So to give you a bit of history on this, again, this is just going over the new user experience here. So in the 80s, we started with publishing our data in the form of printed reports. So you would be able to submit a request, the reports would be printed, and those were for purchase. It definitely didn't come without some challenges. Once you're placing that order, you're not having real-time access to that data. So we decided in the 90s to make it a more access available, if you will. So by now providing CDs that you're able to view that data on, again, keeping up with technology, in 2008, we launched the first platform for web-based. So now you could log into an application, you could get to that data pretty easily, and again, providing for easier access. Since then to now, to 2022, we've had several versions of that web-based platform. Again, we're just always wanting to make for a more intuitive experience as we're working through the system, and as our users are providing feedback to us, we're always going to make those enhancements. So we're going to take a look at that here in just a moment. Let me go ahead and jump into DataDive in a live environment. So bear with me as I move my screen over to show you what we will be viewing here. Okay, so what you should be seeing on your side now is DataDive. So MGMA.com. So once you go to log in, the main landing page, you're going to see this lovely lady with freckles and glasses here. And then from here, you can access the DataDive tool in a couple different ways. So again, wanting to stay consistent with providing you the most ease of access. So the data tab here on the top navigation panel, as I hover over this, I'm going to see that access data now populates for me on the left-hand side under this drop down. So you can access data from this here. You can also access through your dashboard. So once you're signed into mgma.com, you can, under this icon here at the right, you're going to have my dashboard, and then there's a data tab that's located at the bottom of that page. So either way is going to get you to the same spot. Today, I'm going to go ahead and use this access data for my drop-down menu. This is going to bring us to a landing page within DataDive, and I'll talk a little bit about each one of these tabs and what they mean for us. So participate in a survey is how we collect our data. So our data goes through what I refer to as an annual survey cycle season. So our surveys open at the beginning of the year. So in January, those that are participating in our surveys, so whether that's data purchasers or organizational members, they submit their data via this link here, and it goes over to our data analytics team. That team really works around the clock for several months on end, verifying, validating, aggregating, scrubbing all of that data to make sure that everything has been worked out with it and it's good to go. And then they start to publish in the month of May. There's a cadence. So a survey will open, we'll close that survey, another survey will open. It's the same with publishing. We'll publish one survey, and then in a couple of weeks later, we'll publish another survey. So again, that's how all the data is submitted to us. MGMA Stat is a free weekly polling text feature. So this is just a way, if you're interested in receiving some polling information or some real live data in real time, you can click on this link here. It's going to take you to a quick form fill, allowing for MGMA to send you text messages. We send out a polling question every Tuesday with various polls related to various topics within the healthcare industry. So for example, we're seeing a lot of polling questions come out right now related to staffing shortages. So once that poll is released, you can participate or just receive the information. And then on Thursdays, we send out a follow-up text that will have the results of that poll. And it will also provide you with some links and resources that may take you into MGMA. Again, keeping with that example of staffing shortages, our senior advisor team will sometimes pull that education material together. So whether that's a webinar or a podcast or whatever that information may be related to that topic. DataDive Spotlight, I like to refer to this as a graphing form of the data. So this is taking data out of DataDive and just putting it into different graphs for you. This is really intended to give you a quick overview or a snapshot of data. For example, if you're not necessarily wanting to apply filters or maybe get down to a very granular level of data, but you're just looking for total net income loss, this is a great way in which you can pull that. If you're wanting to pull data and apply those filters, or again, get down to that apple-to-apple comparison, you can do so in DataDive. This next tab here, Data Discovery, is a new product that was launched with MGMA just a few months ago. It's actually been in production for quite some time, so we're super excited to have this available for purchase for our members and for data purchasers. This particular tool is outside of organizational membership, so there are additional fees and costs with this, but just to give you some quick insight as to what it is, it's an interactive visualization dashboard. It essentially has the ability to sync to an organization's electronic medical records, and then allows for you to input your KPIs, so your targeted goals, whether that's at a practice or organizational level. By doing that sync, it then will help you to identify areas of opportunity or maybe goals, areas in which the goals are being met. I'm certainly not providing enough justice on this call. This is a very revenue cycle management and operations heavy tool. If there is any interest in looking more into this tool and all that it has to offer, you can just reach out to myself or to Lauren, and we would be happy to schedule you a one-on-one demonstration. All right, the focus of today's call, we're going to look at DataDive. So I'm just going to hop into DataDive here. Right, so for those of you that are new users to DataDive, once you go to log into the system and you click on to DataDive, it's just going to put you into a data set. So wherever you were last accessing during your last session, or if you're new and a new user, it's just going to put you into a data set, okay? To list out the different data sets that we have available and to switch between the data sets or to navigate between, you're just going to click on this change data set here. This is where everything is going to be listed out for you. Provider compensation is a very robust survey that we have. So that's actually been split up into different categories. So in the provider compensation data set, you can locate or find things such as total compensation for providers, whether that's physicians or APP level providers, work RVUs, total RVUs, total encounters, some of those comp to encounter or comp to work RVU metrics or ratios, lots of great information in there. Provider comp also can be found in academic compensation. So this is really geared towards our providers who work for academic facilities, medical directorship compensation, on-call compensation, and provider placement starting salary. Provider placement starting salary is going to be geared towards those providers who are 1 year post-residency or fellowship, or maybe not new to practicing medicine, but new to your organization. If you happen to be an individual who works with provider compensation packages, some additional metrics or benchmarks that you can locate in this particular area are going to be things such as sign-on bonuses or relocation fees. Again, those additional metrics that are sometimes included in comp packages. Next, we have procedural profile. Procedural profile is a breakout of provider compensation. It's a profile that allows for providers to benchmark other providers in the same specialty to identify different billing and coding patterns. Oftentimes when our members reach out to us and say, we're looking to generate more revenue, what tools or profiles might you have in mind that can help support that? This is a great place for us to start in benchmarking and looking at the provider's current billing and coding. Next, we have management and staff. So very similar to provider compensation in the sense that we're still viewing compensation, salaries, benefits and wages, but for all of those positions outside of providers. So if you're looking to onboard a medical assistant and you're wanting to look at maybe the 50th percentile of an hourly rate pay in the southern section, that's very detailed, but that's how we can get to that type of data. Next, we have cost and revenue. Cost and revenue focuses on the overall revenue buckets and expenses from a practice level. So in expenses, we can get to a very granular level of detail. This is where we can identify and benchmark expenses as it relates to medical surge supply or leasing information, furniture, all of that great detail in there. The revenue buckets are going to focus on the major buckets. So if we're looking at gross revenue, net fee for service, we're looking at total, your total investment or your net income loss, we can identify that in there as well. Notably, we use cost and revenue very frequently to look at staffing ratios. So if you're a family medicine practice and you're wanting to look at a body-to-body scenario, wanting to look at, I have 5 docs, how many medical assistants do I need in benchmarking that data to support those 5 physicians? We can look at all those staffing ratios. All right, last is going to be practice operations. You can think of this as an overall structure of the practice from a scheduling standpoint. So looking at some of those patient satisfaction metrics, such as wait time in the waiting room, wait time in the exam room, overall wait time in the office, some of those throughput measures, and you can also identify access. So what's the third next available appointment in a term of days? In this particular section, we can also identify patient portal utilization, or maybe we want to look at turnover and hire rates. So again, a lot of great data located in there. To look at navigation, I'm going to start with provider compensation. This allows for me to show you where we can find some of those resources that will be helpful for you in learning to navigate, and where I can explain how the data sets are actually set up. They all tend to mimic each other. As I click on the category here, different year tabs are going to apply underneath. Keep in mind when you go to sign in, your tabs may look different than my tabs. What we're looking at here is going to be demonstration data, and it's showing me full access. So I have all of the years. I'm going to click on 2020 here. Bear with me just a moment. I was moving too slow for the system, so hang on just a moment here. Okay, so we're going to go to provider compensation in that 2020 year. Okay, So to talk a bit about navigation, and then we'll start to build some examples so I can show you how to apply some filters. First, I want to talk about this middle panel here. So these green arrows here at the top, all this is doing is condensing the navigation panel or expanding the navigation panel, just allowing for easier visibility for the table that you're working in. Save tables here, you're going to hear me refer to this pretty frequently. I'm a huge advocate for saving tables. This is where you can create a table for yourself here. For example, maybe you're onboarding a cardiologist and you want to pull total compensation, work RVUs, and total encounters. You can create that table and then you can save it for yourself under Save Tables. This is a very efficient process in the sense that we know that our data is not going to change for another year because it does go through that annual survey cycle. So when we're looking at data as you're saving it, you can log back in until the data updates again next year. It's all going to be saved there for you. D+ custom reports and tools. For those of you who are familiar with our previous platform of DataDive, this is replacing Pro Report Builder. So this is just a custom reporting, a way to get to that custom reporting to generate some of those reports. This help icon here is where we list out all of our resources for you. There's tons and tons of resources. So as I click on this help section, it's going to bring me to a list of different resources. DataDive resources here at the top. You can click on this and it's going to list out those resources for you. So to talk a bit about that, we have user guides, not only for the custom side of reporting, but also for the front facing side of DataDive. So looking at those tables, video tutorials. Here under number 4, we have a benchmark and filters guide. So if you're questioning, does MGMA even capture data on this particular benchmark? Or what are the ways in which I can filter the data down? This is a great filter guide for you to look at. Under number 5, we're going to have located all of our glossaries. So each one of those data sets is going to be accompanied by a glossary. Really helpful piece of information. So when you're looking at the tables and you're saying, I want to know what's all included in total compensation, it's really going to list all of that information out for you. I've actually pulled that here as an example so we can take a quick look at this. So for example, that total compensation, as I scroll down here to page 5, it's going to provide me with that definition of the terminology we're using. I'm going to show you the metrics that are included and even some of those metrics that are excluded. Important in ensuring that we're benchmarking the same data in the same way. I'm going to scroll down here to page 22 for a moment. You will see that we have a map of the United States under geographic section. This is a map that MGMA has divided into 4 regions, and this is actually a filter that can be applied to the data. So again, if you're looking for podiatry and maybe you want to focus on the Midwestern region, this is a way in which you can compare those states that are most applicable to you. So the regions are listed here, the states are listed underneath. Kind of referring back to that custom reporting, this is also a great way in which we can customize reports for you. For example, I'm in the state of Colorado, and I know that typically our compensation is going to be much different than that of California or even Oregon and Washington. So let's say that I wanted to create a custom region for myself and maybe only focus on the 4 corners or maybe some of those surrounding states. Again, this is just another way in which we can customize data for you. There's lots and lots of options when it comes to that. You'll see that these documents are definitely not for faint of the heart. They definitely can be extensive here, but there's a lot of great information. Again, those are all located here under number 5. So looking at those glossaries, and we'll head back to the front here. Again, here is that list under the help section, and I'm just going to go back to the data tables. The next icon you're going to see is Contact Us. This is going to get you over to our data solutions team. So if you're working in here and you're having questions, and maybe you're not an organizational member, you certainly can utilize this Contact Us here, and we're going to help get those questions answered for you. All right, let's go ahead and start to build some examples now. So all of our data sets tend to mimic each other in the sense they're going to ask you what data is it that you're wanting to look at? What data are you wanting to benchmark? And then how can we apply some of those filters to give you that most apple-to-apple comparison? So first you would choose your benchmark. I currently have total compensation selected. But you can look at these different, again, there's a long list in here. We have ratios, total encounters. If your providers are productivity based and you utilize worked RVUs, this is where you can find that information. Stick with total comp. Next is where we start to filter that data down. So under compare data by and limit data by, you'll see as you hover over the question mark, it's going to explain to you when you're applying that filter. So the difference in compare data by and limit data by, compare data by is going to give me a side-by-side comparison when I'm applying a filter. Limit data by is allowing me to make my selection and only focus or limit the data down to that selection that I've chosen. Okay. I'm going to point out some that we use pretty frequently. So thinking of that map that we were just viewing under geographic section, I'm going to apply that filter here. So then going to take my data. What we're looking at currently is a specialty view. So a list of all of the specialties that we're collecting data for. And then it's going to give me a side-by-side comparison for each of those regions. So for example, allergy, immunology, physician, I'm looking to benchmark compensation for that provider. I'm looking in the Eastern region, Midwest, Southern, and Western. So again, allowing for side-by-side comparison. Another one that we use pretty frequently is this organizational ownership. So this is taking that data and it is separating so that now you can view that information for physician-owned or privately owned practices in comparison to hospital integrated delivery systems. So you have that side-by-side there. Other majority owner is related to providers who work for insurance companies or governmental agencies. So not always applicable in these demonstrations or these calls, but by default, it is going to show for you. All right, last one I really like to use is this trending feature. I use this pretty frequently when I'm looking at work RVUs or if I'm looking at total encounters. The reason being is in those particular benchmarks, we know that we're going to want to see year over year upward trend of data. We want to see growth in that area each year. Want our providers to be always working towards more productivity and seeing more patients annually. Same thought process for total compensation. So what this trending feature allows for us to see is a year over year comparison of that data. So if we're looking at compensation currently for this allergy immunology for this specialty, we're looking at the 50th percentile in 2018, the difference to 2019 or the year over year variance to 2020, and then the year over year variance for the last 3 years combined. To note, also when we get into custom reporting, we can pull the same trending feature, but we can do up to 5 years in custom reporting. All right, I'm going to bring this back to all practices. Think of this as a national level of data. So regardless of where you're located in the United States, regardless if you identify as a private practice or a hospital integrated delivery system practice, it's combining all that data, thus producing one value for us here under all practices types. Again, we have those additional filters in limit data by. You can also, for lack of better terminology, stack the filters. So again, if you're wanting to look at maybe a hospital integrated delivery system and you want to look in the Eastern region, that's a way in which you can apply multiple filters. Just keep in mind when you do so, we're taking the data at a national level, we're applying a filter, which is essentially shrinking the sample size a bit, and then applying another filter, which is doing the same, shrinking it again. If you're ever getting to a situation where your sample size is too small and no longer meets the threshold requirements, you're going to start to see asterisks in place of the data point in your table. It's just indicating that the sample size is too small. When that happens, I always recommend, if you've had multiple filters applied, remove one of those filters, and let's look at that from another angle. To talk about those threshold requirements and what those are, I'm going to click here on percentiles and measures, and I'm going to add our sample size into the table so we can speak about that. So the sample size is reflected by group counts and counts. The threshold requirements that need to be met for us to publish data, we need to receive data from at least 3 organizations on behalf of 10 individual providers. If either of those are not met, we'll always happily collect the data, but we don't publish it, and you will start to see this asterisk in place of the data point. So we can see here for allergy immunology, we received data from 116 organizations on behalf of 288 individual providers. Poor clinical pharmacology. We only receive data from one group on one provider. We would never want you to compare yourselves to one other provider or one other organization nationwide. We certainly want to provide you a robust sample size when you're doing benchmarking. You'll also see in your table that by default, we always publish this median value or the 50th percentile of data, but you certainly can add in additional percentiles as well. So here under percentiles and measures, where I found your sample size, you can add in, for example, we'll pull the 25th and the 75th, but you'll see you have some default percentiles there for you. What it's going to do is just create another column or additional columns in the table for us. So now we're going to see the 25th, the median, and the 75th percentile. In our custom reporting, we actually can pull the data anywhere from the 10th to the 90th. So if you're looking at work reviews and you want to pull a range from the 40th to 60th, we can do that for you. If you're wanting to pull from the 10th to 90th, so 10, 11, 12, all the way to 90, we certainly can pull that for you as well. All of that is available in custom reporting. All right, I'm actually going to remove some of these. It's just a bit easier on the eyes when we're looking in a demo environment, and I'm going to talk more about this table. You'll see that it's listed out alphabetically, starting with allergy immunology here at the top. As I scroll down the table, it's going to start over alphabetically again after urology. Just a moment here. I'm wanting to talk a bit faster than it's wanting to move. Give me just a second here. Okay, while we're waiting for that. So the transition, what it indicates as I scroll down after urology, and it starts over alphabetically again, you'll see with anesthesia assistant. What this indicates is the transition level from physician level providers. So we're looking at MDs and DOs at the top of this here, at the top of the table. And then all of your APP level providers are going to be located in the same table. They're just separated and organized to where the APPs are at the bottom. Okay. So if you're looking for an NP or PA, you'll see as you start to scroll down, NP is going to be included first, indicating that this is a nurse practitioner that we're looking at. Transparently, the most efficient way to look at this is to use the search feature here at the bottom. So as I start to type in, for example, cardiology, any of those positions with that naming convention, so any of those specialties are now going to populate for me in the table. I can see here that I have those physicians, and then I can see at the bottom here, it's also including those APP level providers. So we can see NP and PA as well. You can always scroll if you would like to do that manually as well. It'll get you the same information. All of this data can be exported out. So again, you can save tables as you create those save tables for you. Save down here. It can be exported to PDF and to Excel. Keep in mind, the more data that you're trying to export, sometimes the PDF option goes away, but you'll always have the ability to export out to Excel. One cool trick I would like to show you in this data set, please take cool trick with a grain of salt because I do like data. But what we're looking at right now is a specialty view. So let's say, for example, I'm wanting those multiple benchmarks. I want total comp, I want work RVUs, and I want total encounters. I would acknowledge that if I'm looking at that for a particular specialty, I'm having to go back multiple times and make those different selections from a benchmark standpoint. You'll see that all of these specialties are written in green, essentially. What that means is it's a clickable item. I can click on this. So let's say that we want to look at cardiology invasive. As I hover over and I click on cardiology invasive, what's going to happen is my table is now going to flip for me. So instead of viewing a specialty view, now what I'm looking at are all of those benchmarks, and I've chosen one specialty here, and that's replaced the benchmark view previously. You can do that for any of those specialties that were listed out. You would just simply make your selection. And now I have all of that data from those different benchmarks here in my table for me. From here, you can filter down even further. So again, if I wanted to focus on total comp, total encounters, and work RVUs, I can make those selections. I can condense here. And now all I'm looking at is focusing on those metrics that are most applicable to me. Okay. From here is where I recommend saving that table. you ever get to this view and you're like, no thanks, or I want to look at I prefer looking at it the other way, no worries. All you're going to do is just click on any of these. Again, they're green, so they're clickable. I'm going to click on total compensation and it's going to flip it back for me as well. This is also important when you go to log in for the first time. Sometimes that will be changed. So you're looking at a benchmark view instead of a specialty view. Just know that they're interchangeable and you can flip them. All right, from this screen, I'm gonna hop into custom reporting very quickly to show you what the custom reports looks like. So just D+ custom reports and tools. Again, for those of you that were with us on our previous platform, this did replace Pro Report Builder. If you had generated reports in Pro Report Builder, when we moved over to the new platform, those will follow your access. So those reports will now generate for you and still show in your same list. We know that on the front-facing side of DataDive or in the table view, we need to save reports. When we're in custom reporting, they automatically save for you. From this screen here, you can build or create a new report. They're both going to do the same thing. And then very similar to the front-facing side or the table side of DataDive, it's going to ask us to make some selections. I'm going to stick with provider compensation, stick with that senior demo data. And then here, when we're looking at MGMA standard report, what we're doing is we're benchmarking all the data that's been supplied to us. Add My Practice data is a feature in which you can upload some of your own data. So for example, if you're wanting to benchmark your provider's compensation and work RVUs in comparison to the compensation and work RVUs that have been submitted to us by specialty, it's a way for us to add that onto a scatter plot graph for us to be able to visibly see that. All of these steps are included also in that user guide. So not only do we have the user guide for the table side, but also for custom reporting as well. Tools and report layouts. This is where it's going to ask you, are you wanting to look at multiple specialties and maybe only focus on total comp? Are you wanting to look at multiple specialties and focus on additional measures? So comp, encounters, work RVUs, whatever data set that it is that you're working in. So you can make your selections here, and then it's going to provide a description of what that report is going to entail for you. Also imagery here on the right-hand side. I'm going to continue. And then again, you're going to make your selection. So for this, I'm going to go ahead and select family medicine without OB. This is under the physician category. Let's say under the APPs, I want to look at an NP family medicine without OB and maybe a PA family medicine without OB. Whatever is most applicable to you and your practices. And then here's where we start to have more benchmarks that are available. So I'm going to stick with those standard 3 that I like to pull very, very frequently. So total comp, total encounters, and then work RVUs. This is where you can start to indicate the provider's full-time or part-time. Compare data by, so we still have those filters. As you can see, the list has grown. And then limit data by, you're going to see this is substantially grown. So we know on the table side or on the front-facing side of DataDive, we have about 5 to 8 different options when we're looking at limit data by. As you get into custom reporting, this is where it gets very, very extensive. I'm going to apply a geographic region. I'm going to go ahead and look at the Western region here, but you'll see that there's lots of options. Choose percentiles and measures. It's by default going to show us those standard measures, but let's say that we wanted to now customize this. So I want to look at 25 to 30 and I want each individual, and I want 50 and maybe 55. This is underneath is going to tell you if you're wanting to create a range or if you're wanting to look at specific numbers. Group counts and counts. I'm always going to be an advocate for adding in your sample size. Not only does it provide you the information of how many providers your providers are being compared to or whatever the data is that you're looking at, but it also will help indicate, okay, this is a pretty robust sample size and I'm likely able to apply another filter. You're going to name that and save and continue. For those of you that were in Pro Report Builder before, this is probably one of my most favorite features. In Pro Report, there was an additional step. It would make your selections and then you would have to go back and process the report. This just does it for you. So that's a nice feature here. Okay, so we're looking at our family medicine without OB. I have the physician here, NP, PA, looking at full-time, the Western region, total compensation. It's going to show me those percentiles from which I made my selection. total encounters, and work RVUs. So everything's located in that one large file or that one large report. Your sample sizes are also going to be included. From here, you can export this information out again to PDF or Excel. And there's a new feature on the back listed here as share. So maybe if you work on a finance team and you're wanting to share this report internally to ensure that everybody's pulling the report with the same values and the same percentiles and the same filters, it's a nice way in which you can share that now internally with anybody who has the same access. These are always going to be housed for you under My Saved Reports. I'm just going to click back up there. The one you ran, the most frequent, is going to be listed for you here at the top. From this drop down ellipses here, you can also from here download the report. You can view the report. You can edit if you want to go back in and make some changes, not creating as much rework for yourself. And then you can delete from here as well. As you can see, I'm not a good steward of deleting, but I definitely would recommend it freeing up some space for yourself. Okay. All right, so that's all custom reporting. I'm going to go back to where we were previously. So looking at those tables, so we're going to return to data tables here. I'm going to hop into some of those other data sets to show you what features we have in there as well. So to navigate between the data sets or to change, I'm just going to change data set here at the top. And I'm going to hop into procedural profile. So all of our data is again going to be located in here as it relates to providers who want to benchmark other providers in the same specialty. This is really intended to show frequency of CPT code usage. Just a second here. Okay, while that's waiting to populate, I'll give you an example of ways in which we use this particular profile. So again, if we have groups that reach out to us and say, we're looking to identify additional revenue streams, maybe they pull their top 20 codes that are built out by their providers on their side, and then we're able to benchmark top 20 codes for that same specialty on our side. So it's a really great indicator of E&M codes. What are those E&M codes that are being coded out? It breaks it down to a code level. So not only looking at that description of inpatient visits, established visits, new visits, surgical visits, but it also will break it down to show what those codes mean. Okay, so here I have that family medicine without OB. I'm going to stay consistent with that example today. Under select CPT code range is where we're going to then be able to break it out by those ranges. So again, E&M codes, if we're looking at surgery codes, maybe procedural based billing, other HCPCS codes. All CPT codes is going to produce one long list of all those CPT codes. And then top 20 codes is going to be just that, the top 20 codes. You still have the same ability to filter some of that data out here on the left-hand side. Let's go ahead and take a peek at our new patient visits. So under the description, as I click on new patient visit, again, it's now going to give me a breakout of those codes. So the way that we would read this is that 99203 from a new patient visit for family medicine without OB at a national level. This is billed out more frequently than a 99201, more frequently than a 99204. Okay. Liz Gurley at MGMA would never ever say, you know, that there's just changes that can be made. We certainly know that that is not how that goes. It's all driven by the provider. With that being said, before I joined MGMA, I was a practice manager for about the last 15 years. I would pull this report and I would look at this with my providers and we would be able to identify, okay, are we billing and coding appropriately? We often recognize that providers undercode their whole great hearts, or they just want to treat patients and they want to do what's right for patients. This is just a nice way to ensure that we're billing and coding for the work that's actually being done. So a great way in for us to compare that data. We'll also see here that when we export this information out, it can export out for us in a bar graph, a pie chart, or also your bell curve distribution. So again, if you're not wanting to look at all of the data in terms of numbers, but you're wanting more of a bigger picture, this is a nice way to produce that. You can save, export to PDF, which will print those reports for you in forms of imagery, and then also Excel as well. All right, moving along here, we're going to hop back up here and change data set, and we'll go to management and staff. So again, management and staff is focusing on those salaries, benefits, and wages for all of those positions outside of providers. The data set is very similar to provider compensation. However, there's some new changes. So we know that when we're looking at providers' compensation and we want to get that down to a state level, we have to create a custom report. That option is not available for us in the table view. For management and staff, it is. So here under choose a region and benchmark, it currently says national, but you can break down this data to look at a state level. Again, as long as the sample size is robust enough and meets those threshold requirements, you now can look at that at a state level. You're always going to have geographic region or national as well. Next, we have the different benchmarks. So total compensation and hourly rate compensation. Total comp is going to be reflective of those salaries, so salaried positions. Hourly rate compensation is reflective of hourly rate compensation. I'll stick with hourly rate here. You'll see that my list isn't very long. And the reason being is because I'm currently looking at a roll-up list. So we're actually going to want to unselect roll-ups. And now it's going to produce one long list of all of those roles. In the management and staff glossary, you actually can see each one of these roles listed out, and it is provided to you with about 3 to 5 bullet points of a job description. Sometimes we may have the naming convention different at MGMA than the naming convention different in your organization. So it's just a nice way, again, to ensure that we're looking at the same data in the same way. You can still, those filters that we know and love. So looking at it geographically, if we're wanting to break that down, organizational ownership, all those, but we have some new ones in here as well. So there's a way for us to look at certified in position. So for example, if you're wanting to hire a medical assistant and you're wanting to say, I want to look at compensation from a standpoint if they are certified or registered in the position in comparison to maybe somebody who's not, that's a filter that can be applied. We also have formal education level. What comes to the forefront of my mind is maybe managers, supervisors, directors. If you're wanting to compare compensation for somebody who holds an associate's degree, bachelor's degree, an MBA, or maybe somebody who does not hold those credentials, this is a way in which you can compare their compensation. Years of experience as well, as we know that's important when we're looking at those positions. I'm going to leave that on that all practices level. Under limit data by, again, is where you can apply an additional filter. So same as the other data sets. And then you'll see here, again, very similar to provider compensation, all of those positions are going to be listed out. I'm always going to be an advocate for the search feature at the bottom. So for example, as I start to type registered, anything with that naming convention is now going to populate for me. So we're seeing that we're bringing up our registered nurse. I don't have any additional percentiles or my sample size selected in percentiles and measures. So it's just by default always going to show that 50th percentile of the data that we're looking at. Okay. Again, you can add these features in if you would like to. And we'll look at that same position now that I've added in a couple different percentiles and measures here. Start to type in registered. And now we're seeing for the registered nurse position, I have my sample size, the median value, and I added in the 75th percentile as well. All this information, same as the other data sets, can be exported out. So you can save some tables, export to PDF, and export to Excel as well. All right, we're going to hop in here to cost and revenue. So again, this is looking at the different expenses at a very granular level of detail and also looking at the different revenue buckets, all that great information. As I mentioned previously, we use this very frequently when we're looking at staffing ratios. So I'll go ahead and start there. That's what's currently selected. So sticking with my example of family medicine, again, you can make a selection for the specialty that's most applicable to you. Here I've chose staffing. And then this particular data in this data set is submitted to us at a practice level. So it's combining the data from the practice overall and submitted to us in that fashion. When that happens, we need a way to divide that data out and to normalize that data. So we now have this select a data cut. So for example, when we're looking at staffing, we know that our organizations all staff differently. So maybe your organization staffs from a body to body scenario. 5 providers, 5 MAs, 5 clinical or 5 front desk support staff. So when we're looking at that body to body, we're looking per FTE physician or per FTE provider. The difference in the two is physician is going to be reflective of just those physicians. Per FTE provider is going to be reflective of physicians and APPs. So it will be a combination of both. Again, all of those definitions are located in that cost and revenue glossary. Some of our practices may staff to productivity. So maybe they staff for every per 10,000 work RVUs combined within our practice, how many medical assistants or how many clinical support staff do we need from that standpoint? Maybe you staff to volume. So looking at per 10,000 patients or per 10,000 encounters. Again, I would always recommend when looking at staffing, you just pull it in a couple different ways to see what is most applicable to you. For this example, I'll stick with per FTE provider. So this is assuming the practice I'm looking at, family medicine, and we are looking at a practice that would be inclusive of both APP level providers and physicians. Still can filter that data down, so you still can apply those filters. I'm going to go ahead and show you what medical assistants look like. If we're looking from that clinical support staff, as I scroll down here, we're going to see total clinical support staff. Let me add in our sample size here. Give me just a moment as that populates. But the way that we would read this data, we currently have the 50th percentile selected. Okay. Our group size, we received data from 435 groups or practices on this data. And what we're looking at here for family medicine staffing per FTE provider, we would need, if we're using that 50th percentile, what that would support would be 1 and just shy of a quarter employee for every per FTE provider in family medicine. You will see underneath that this is broken out. Oftentimes these added together are not going to equal that total amount. And the reason being is that the sample size is just different for each. Okay, so for example, we may have a hematology oncology practice that reports their data to us and they say, based on the services that we provide and the nature of the care that we provide, we only utilize registered nurses, or we only staff licensed practical nurses. So there may be a difference there where maybe you have some practices that say, you know what, we only utilize medical assistants. So it's just really dependent upon the specialty and upon each practice. What we would recommend when using this data and benchmarking is to use this total bolded line here. So when you're looking at that FTE of 1.23, just 1 1/4, you as an organization then make the best determination for you. So if you're saying, you know what, in our hematology oncology practice, we're going to use that 1.23 FTE and we're going to allocate that to an RN. Or maybe you say we're going to allocate that to an MA. So you're making the best determination for your practices in your organizations. You certainly know them much better than we do, but that's how the data would support in that way. All right, so coming back up here to staffing, we have some other benchmarks that we can view in here. So if we're looking at AR collections and payer mix, this is going to show us the different revenue aging buckets. So if we're looking 0 to 30, 31 to 60, so on and so forth. As I scroll down, I'm actually going to see the payer mixes. So whether I'm wanting to benchmark looking at those government payers, looking at commercial payers, or looking at self-pay, it's all going to be located here at the bottom of the table. Looking at expenses, again, getting to that very granular level of detail. If you're wanting to benchmark med-surg supplier, you're wanting to look at your overhead cost. Sorry, again, you're going to select your data cut there. If you're working maybe on provider compensation packages and professional liability insurance, or that malpractice component is also something that you provide to your providers, we view that as an expense. So you would find that information here in the expenses category. All right, looking at charges and revenue, again, focusing on those different revenue buckets here. So if you're wanting to look at gross, or you're wanting to look at net fee for service, net other medical revenue, net non-medical revenue, income loss, you can find all that great information in here as well. All right, I'm going to go ahead and change our data set and we will end with practice operations. So again, thinking of the overall structure of the practice coming from a scheduling standpoint, The first area that I have selected here is demographics. So the specialty is family medicine, but we're looking at demographics. And then here under compare data by, this was a list of questions that was asked to survey participants. These were elective questions. So sometimes you will see that the response rate may be a little bit lower, the sample size is a bit lower. But you'll see there's lots of great questions in here. So this first one we have is action taken to improve wait time. This is just responded to us in a yes or no version and then shown in a bar graph. Directly underneath that is charge a no-show fee. So in family medicine, those that responded to us, this is how many say, yes, we do charge a no-show fee. No, we do not charge a no-show fee. Total operational hours is going to be the hours that the practice is open. So not necessarily billable clinical time, but looking from an overall standpoint, how many hours is the practice open on a Monday, Tuesday, Wednesday? So it will go through the days of the week. It will show weekend hours if those are applicable. And then we'll show you number of hours per week. Patient portal utilization. If your patients do utilize a portal system, this is telling us, do the patients log into the portal system? Once they do, how are they using that? Are they doing so to request a refill, view a lab, communicate with their provider, schedule an appointment, pay a bill, all of those different metrics that are associated with patient portal utilization. We'll also look at scheduling here. So scheduling, again, is really focusing on those metrics as part of patient satisfaction, looking at those wait times, looking at access. So it starts off here with minutes spent in waiting room, minutes spent in the in the exam room, total wait time in minutes. You can see lots of different information here, looking at those average appointment times by appointment type. That's going to populate for you here. Third next available appointment. We recognize that typically first next and second next are going to be those same day holds or cancellation slots that are trying to be filled. So that's why we report on the third next day. You'll see here no-show rate is listed at the bottom. No-show fee. So if there is a no-show fee charge, what does that no-show fee look like? Some great information as far as co-pays go. Percent of patient due balances collected at time of service, or percent of co-payments collected at time of service. Some that great information here. Okay, we'll also look at turnover and hire rates. So keep in mind what we're looking at right now is 2020 data. We certainly anticipate that the 2021 data is going to look a bit different. In 2020, we didn't see as much turnover and hire in terms of rates as we did in the year 2021. So definitely anticipate that this is going to look much different. So you'll still have the same ability to export all of this information out. All listed here for you. I know this was a lot of information in a very short amount of time. I'm sure that Lauren has shared my information in the chat. You certainly can reach out to me anytime that you have questions. If you're an organizational member and you're interested in scheduling some one-on-one time, some demonstrations, I'm always happy here and available to help. I'm going to turn it back over to Lauren.
Great, thanks, Liz. So on behalf of all of us here with MGMA, we just want to say thank you for spending part of your day today. We know how valuable your time is, so we really do appreciate you. And then as Liz mentioned too, if you're interested in scheduling that one-on-one, her email address is dropped into the chat. And then we will also have a recording after today. So just be on the lookout for that recording that's going to be coming out later on this afternoon or tomorrow. That way you're able to refer back to this if you want, or if there was anyone that you know couldn't attend and may want to still view and watch this demonstration, we'll have the recording that you can share. Again, thank you for joining with us today and have a great evening. Thank you.